With mid-session bill deadlines approaching in the next few days, legislation is moving swiftly at the Indiana State House. Now, among this week's headlines, action by the Indiana House over bipartisan opposition, approving a resolution calling for a federal constitutional convention on term limits. Both chambers of the State House passed measures designed to increase access to child care by reducing existing regulations. On Monday, the House approved a bill providing more scholarship opportunities to Hoosiers who want a career in education. And we'll learn more about transition to teaching scholarships in a few moments. And we'll also hear about a measure in the Senate to establish a Community Cares Initiative grant pilot program for the purpose of assisting in the costs of starting or expanding mobile integrated health care in Indiana. Our guests are from the Senate and the House for a conversation you can join from your house on this edition of PrimeTime. Good evening, I'm Bruce Haines. With us today is 14th District Republican State Senator Dr. Tyler Johnson and 85th District Republican State Representative Dave Heine. And you can be a part of us as well. Telephonically, just call in with your questions or comments. Just use the number you see on the screen as we broaden out and welcome you to the show. And welcome Dr. Tyler Johnson, Representative Dave Heine. And Tyler, Dave, Happy New Year. Welcome.
Thank you. Good to be here.
Pleasure to have you with us. It was a big week. I know everyone's looking for halftime. But there was kind of where the football analogy and say, the rugby analogy, there was maybe a scrum of sorts on Thursday. There was an agency bill on Medicaid matters that passed unanimously out of committee. It died yesterday following the addition of several bipartisan amendments on transparency and accountability on a $1 billion Medicaid funding shortfall that's worth a comment even of itself. And then Senate Republicans killed their own priority bill to sharply curtail prior authorization. As we look through the news coverage and try to sort it out ourselves, I'm hoping you can shed some light on what actually happened yesterday to these House and Senate measures. Tyler?
Yeah, so I mean, the Medicaid bill was, FSSA actual bill was in the House. So there was a lot of amendments and things filed to that. I don't know the behind the scenes of why that bill didn't move, but one of the issues we're facing right now is the forecasting for Medicaid. The numbers were about $1 billion off. That's a big gap in numbers. And so there's a lot up in the air right now that we're trying to figure out and fix through a number of different ways, but it does change things a lot in that system. And so one, finding the money, and two, figuring out how to do that going forward. I think really letting the agency try to figure it out first is probably the bigger picture, and letting them go through that. And then legislatively, the budget agencies and the budget committees can kind of look at that as we move forward next year.
Mm-hmm. Your bill, SB 3, on prior authorization, explain a little bit about what that is and now why it has left the top 5, at least for now.
Yeah, so Senate Bill 3 was a great concept. It's not a novel concept to limit prior authorization, which is where you have insurance and have covered services like a drug or a total knee replacement or something like that. But the insurance company makes your doctor ask permission, even though your doctor thinks it's the right thing to do beforehand. Well, it adds a lot of administrative work for the hospitals and physicians, and then it delays care for the patient. So we really want to take that delay and the burden off of the hospitals and get the patients the care that they want. And there's study after study showing the benefits of reducing that time. And if you put roadblocks in the way, then the patient never will come back and get the care that they needed. So long-term outcomes are worse. Well, so Senate Bill 3 really addressed that in a comprehensive way. And it was a big bill. So it looked at a lot of different ways to rein that in. And try to limit that and protect the patient.
Mm-hmm. Dave, anything you want to share on the
Well, I'll
last
just add
24
one
hours?
thing, and it drives me crazy about government. A good bill starts out as a good bill, then it starts gaining amendments, and all of a sudden it goes from a great bill to a good bill to, we have to talk more about this, like Doctor said. We have to talk more about this with the budget agencies and everyone involved to make sure that it's a good bill. That's the one thing. You pass a bill and there's a lot of unintended consequences. and that was the path we were going down. So on our side, we just killed it.
There's certainly big impact bills that are gaining attention, and one of them, which has been with us for a while with statistics to support, is SB 1. And you're both involved in different efforts within education, but both chambers also moving 1001 is a workforce bill which also ties to the classroom and encourages additional literacy activity. SB 1 also passing yesterday, Tyler, and this is all about something we've heard called the I Read 3. So you can define that one too as we go into what the bill is attempting to do.
Yeah, we've clearly identified that we have a problem as kids move through school, and we really haven't found the solution with a bunch of different movements over the last few years. We passed some legislation to change how we teach reading a little bit, but I don't think we found the solution there. And so looking at statistics and where kids learn to read, it's early. So you're talking kindergarten, first, second grade. And so we want to identify that as early as possible. I think the best thing of that bill is we're going to start looking earlier and earlier at the reading skills and education of kids and make sure that when they're moving through school, they've actually learned how to read, because it's really hard to do everything else in school if you haven't gotten to that point.
And this is something too where we're trying to not hold back those that have passed, move forward, but I think one of the challenges in all the legislation is how to help those who have had those challenges with the test, and yet to this point some have moved on without getting that corrected. And Dave, what's your sense of these things from the House?
Well, I think my sense is that we are communicating, we are really vetting this, and I think when it's all said and done, a month from now or a month and a half from now, I think we'll have a good bill.
And some hopeful funding. I think it was the Secretary of Education or State Superintendent of Schools had said that there could be funds found to at least help with the science of reading and get some of this activity started, perhaps even in the summer.
The dollars are there.
So in a short session, that's a good thing. Nothing necessarily is opened up then at that point? Would that be fair to say?
Well, we can just appropriate the dollars inside that agency.
That exists without going over the, okay. Speaking of dollars and education and other opportunities, a bill that is moving to the Senate for consideration carries Representative Heine's imprimatur, and I'd like to have you share what is transition to teaching, the scholarship program that you brought forward.
Well, thank you. A year ago, we had a bill that passed, and it was really developed by Marilyn Hissong, Superintendent of East Allen County Schools, who, by the way, was also the Superintendent of the Year, so we're very proud of her. But we had a transition to teaching program where if you have a 4-year degree, you can apply and get a $10,000 scholarship if you remain in teaching for 5 years. So one thing happened, we put $1 million cap on that. That meant 100 teachers throughout the state. And when people applied for that, there were 300 people applied in 15 minutes, and I was told by the Department of Education over 1,000 people applied. These are people that want to be teachers. They've got a 4-year degree in something else, so they have the passion for teaching. So what we did this year, we have some dollars in the Next Generation Hoosier Scholarship Fund. We think about $3.2 million will be available. So what we did, we expanded that. So this next year we'll be able to have roughly 320 teachers around the state. So it's really exciting, and I wish it was my idea, but it wasn't. We just got it through, and hopefully Tyler's going to be carrying it over on the Senate side, so we'll get that through. Yeah, right, Tyler?
The serendipity is not lost on me. I'm like, I need to ask him about this because Tyler Johnson's the Senate sponsor.
Yeah, so Representative Heine is my state representative, so pretty proud to carry a bill from him on the Senate side. this is a great concept. Getting people that want to go teach kids into the education system and fill a hole, a gap that we have is pretty cool thing. And to help people get there is a good way to do it. And so I think what we're doing here, no promises, but it should be something that our Senate takes up pretty well. So.
Neat. We are talking this evening with State Representative Dave Heine and State Senator Dr. Tyler Johnson here on PrimeTime. We're live in studio if you'd like to call and join us with a question or comment, as Kim did, sharing a thought offline, wondering if there will be any proposals for early childhood education programs for reading before kids enter school.
Yeah, so last year through the libraries and the Dolly Parton program, we did start sending kids books, and you can sign up for that. And so it is kind of a good program that we did last year during a budget session. Childcare was a big part of this year, but we don't have any specific reading programs before kids are in school other than that I'm aware of right now. But it's a good idea, and we always encourage parents to start their kids reading early at home and find places where they can do that, but there's nothing specific that I'm aware of right now.
Yeah, and if I might add, a program like that's going to take dollars, and so we have a biannual budget, so anything that has to do with a new program, new dollars, we need to do that during a budget year. And I've heard some ideas on that. That's not going to be something that, one of our education people will probably draft a bill on that, but there are rumors that that's going to happen.
From early childhood education to child care, which connects in so many dimensions, not the least of which to economic development as well as educational attainment. You're both involved with several pieces of legislation on how to facilitate the additional staffing needed, among other things, to fill in or address the need for child care workers. Dave, talk a little bit about 1102, if you're scoring at home, which is known as a child care bill and what it's attempting to accomplish.
Well, when you start out with the bill, you try to get 100% participation from, 100% of the votes, and we got 75 the other day, so it passed, and we're sending it over to the Senate side. But all we were trying to do is some common sense reductions in some of the regulations that we have in child care. All we are trying to do. And you would think that we're trying to kill children. And basically what we're looking at is unlicensed child care facilities that today are in current law today. And those facilities can, it's the mother down the street that just wants to take care of children. Well, some of the regulations were just, you can only watch 5 children. You can only watch them 4 hours a day maximum. So kids that would get on the school bus at the beginning of the day, you couldn't have 4, 5, 6 children coming just for 15, 20 minutes and then get on the school bus and then get off on the school bus at the end of the day. That's illegal. So what we did is just some common sense reductions in regulations to make that possible. And we got 75 votes, and so we're sending it over to the Senate side, and Tyler's going to be a sponsor on that one too.
It says so right here, Tyler. What is it that attracted you to this proposal?
I mean, we really do need to strike a balance in this space, where we've put too much regulation on the space to where people are actually getting out, and it's expensive as it is. So we really do need to find that balance of where kids are safe and protected and there's a good environment for them to be watched, or some of these places are actually really advanced child care facilities where they're learning and doing early childhood education, and some are actually in school buildings. So we're looking at all these different areas where we can actually have child care. And we spent a bunch of time this summer talking about this in our health summer study committee, which is Senator Charbonneau, our chairman, spent a lot of time walking us through that and hearing from folks. And it really does become a workforce development and economic development. If you need to grow jobs, you can't do that if people have somebody to watch their kids or they don't have somebody to watch their kids.
You know, I might add, you know, some of our school districts around the state, they have child care facilities inside the school. And one of the things that this bill did is right now it's just for teachers, you know, child care for the teachers that work at the school. All this bill does, anyone that's contracted with the school district, i.e. food service people that do lunch programs there at the school, they can bring their children into that child care facility, so that way we can have workers can make it convenient. They can bring their kids, have the kids being watched with the teachers' kids while they're performing their services for the school. Mm-hmm. So it's all common sense reductions in just reductions in regulations.
For people who are following this closely, because they are the ones hoping to find supply with the tremendous demand, on the backside of this session, as legislation moves, this passes, as this example goes, how soon can then structures be adapted to accommodate and be able to, you know, be able to deploy more workers out in the field?
Well, that'll depend on the situation, but it'll be effective July 1 that they can, you know, as soon as the bill gets signed by the governor, everybody will have an idea how they can take advantage of it in their particular situation.
And of course, Senate Bill 2 is doing its work on the child care side, and I believe that one is now moving across the hall.
It is, and the two are, they kind of tackle it in different ways, so they go hand in hand, but they're actually two kind of separate bills in that space. And it'll take some time for things to get implemented with Senate Bill 2, because there are some regulation and deregulation in there that'll have to go through some of the agencies and rules, but it should have a good effect down the road here.
Mm-hmm. One of the things we touched on at the top of the program is one that is a bill you co-authored, Tyler, and along with others from our region, including Senators Bush, Dorio, and Brown, and that is the Community Cares Initiative Grant Pilot Program. We're making health mobile. Talk about that.
Yeah, this is a rather new concept in medicine. That's actually an old concept. You actually send people out to take care of people, take care of them where they're at, and try to get them the best health care they can there. Keep them out of the hospital if we can. That's the most expensive setting you can take care of somebody in, but if they need to be there, they need to be there. And so we've had paramedicine programs and a lot of different things like that for a long time in healthcare, but allowing some of these initiatives to kind of coordinate care and catch people in illness early will really help save healthcare dollars down the road.
And the other medical piece, which is a Senate priority bill, is one that has not had a lot of discussion necessarily, but we know it's out there, and that is lead water line replacement and lead remediation. The time has come.
It has. And we're doing a lot of stuff in this space already. This bill really just helps accelerate what's already happening and allowing lead lines that are in Indiana, even, you know, some cities still have lead lines or at least some lead there. And so allowing the utilities and companies to come in and accelerate the process, that's really what that bill does. So we're not sitting for another 10 years to have those removed.
Right. As you're watching and we're updating to see what bill is going where next, and we're heading into the second half of the session, what legislation are you finding interest in for yourself, whether from your own hand or from those of your colleagues? Yeah,
so we're heading into halftime here. We have a lot of real interesting bills coming over from the House, and we're going to send some real good legislation to them. And so we'll take a hard look at a lot of bills. I think there's some bills around insurance and how we pay for things that I'll be taking a deep look at in that healthcare space, especially in the ambulance realm, and making sure people have coverage when they think they have coverage. And so that's kind of the thing that's at our top of mind right now.
Mm-hmm. Dave, how about you?
For me, it's child care. We have the Senate bill and then our bill in the House. I think we really have a great opportunity to take some of the regulations off. You know, right now, we have 500,000 children that need child care in the state of Indiana, and we only have seats for 206,000 people. So 41% capacity, that is wrong. And we have a real opportunity right now, and it's high on everybody's list. And when it's high on everybody's priority list, that's when you need to get across the finish line. So be spending a lot of time second half making sure that we can get closer to that 500,000 goal. Because very important. These are the kids that are going to take over for you here.
Can you speed them up a little bit?
But we need to make sure that we
friendly
take care of them.
Yeah. It was something, too, that feels like it has more momentum in this session is 1002, which is a bill passed earlier in the session. David, you were co-author of it, the idea of defining anti-Semitism, specifying that public policy at the state is to provide educational opportunities free of religious discrimination. This came from the House before.
Last year.
And didn't make it over the finish line. Let me ask your prospects, what your sense is, and then also for the senators.
I sense that it will pass the finish line this year because we've talked about that all summer, that we passed it last year and it didn't pass the Senate side. So, you know, as you can see here, we work together, and I'm not sure what happened last year exactly, but we work together, so I feel very confident that that'll pass Senate this year.
Yeah, and it's an interesting concept to put it into a definition, and I think it's doing that's the right thing. I think the finding out how we do it more than what we do is the question at this point, and so I think that's something we'll take up real early on our side in the second half and take a deep dive into, and I think from my perspective, hopefully we can get something done there.
Mm-hmm. In the time we have available, I recall there was discussion of putting the focus on not just US 30 east-west, but US 31 north-south. And I understand that there is certainly legislative interest, if not state government interest. And from November to now here in February, what is your sense of whether this particular, here we go with football, ball has advanced down the field any more or not? I'm sure a lot of folks can catch the vision anyhow.
I'll take it first just to say that my representatives worked really hard on this a long time before I got into office. So I just do want to say that people don't always see the work that goes on from a legislator, but now where I sit, I see it. And so he needs some accolades for the work he's put into it so far.
Well, 2018, I was just looking at my notes the last time I went in to talk to the Commissioner of INDOT. 2018, the Commissioner of INDOT told me that 30 would never be a freeway. And here we are today, and 30 is going to be a freeway. But what we've done with the help of everyone, what we've done is got the businesses behind it, and you know, we just need to get a commitment. And I'm going to just tell the viewers right now, you know, we have a governor's race coming up, and there's 5 governor candidates, I believe, maybe more now, but we need to make sure that whoever you see, you know, if somebody comes to Fort Wayne and makes a speech that's running for governor, you need to ask them what's their view of US 30 turning into a freeway and get their commitment, because, you know, Governor Holcomb will be gone a year from now. And we need to make sure that the new governor is behind US 30 becoming a freeway. Because let me tell you, inflation used to cost $20 million to build an interchange. Now it's costing $60 million. So the money, you know, that we have available for this, you know, everyone in the state's wanting the money to do, you know, to do road work in their area. And we need to make sure those dollars are funneled up here so we can have US 30 be a freeway. It's so important to the economic development of northern Indiana.
Lots of things traveling in the road for success, the road to bring us together, and of course there are lots of upsides to having that completed and to see it build and so forth. In the final minute we have, any other aspiration for the second half?
Yeah, I think we're going to work pretty hard in the healthcare space for sure, but it's always interesting the second half to see the House bills as they come over and what's going to get taken up. And We slim the bills down quite a bit, and then we slim them down even more so that we can focus on certain things. So that'll be interesting here in my second session.
And your final 30 seconds.
And I would just tell everyone that, we work together. Your Northeast Indiana legislators on both sides, Senate side, House side. We get together for breakfast every Wednesday morning, and we talk to each other about every bill, not just, what we have going on. How's it going to benefit Northeast Indiana? And we try to get everybody to advocate for that because, everybody sits on different committees, and we have a good representation, and we can influence a lot of votes. So that's what we try to do.
We'll continue to share that work with you every Friday night at 7:30 here on Primetime. With us tonight, 14th District Republican State Senator Dr. Tyler Johnson, 85th District Republican State Representative Dave Heine. Gentlemen, thank you very much.
Thank you.
Thank you for watching. For all of us with Primetime, I'm Bruce Haines. Take care, and we'll see you next week. Good night.
The preceding program on PBS Fort Wayne was made possible in part by
Businesses constantly evolve. The Rogers Company started as Rogers Markets in 1944. Today, the Rogers Company is commercial property and real estate development and a proud supporter of PBS Fort Wayne. The Regional Chamber of Northeast Indiana advocates for world-class infrastructure, a competitive business climate, 21st century talent, and rural investment. One region, one voice. NEINadvocates.com.